Why is my osteoarthritis pain worse than my X-ray? Imagine feeling intense pain in your joints, yet your X-ray shows only mild changes. That situation can be confusing, but it's actually quite common. Many people wonder why their pain feels worse than what their imaging suggests. The reason lies in how osteoarthritis affects your body and what X-rays can reveal. X-ray imaging is the most common way doctors look at osteoarthritis. It shows changes in the bones around your joint, like joint space narrowing, which means cartilage is wearing down. It can also show bone spurs called osteophytes, areas of increased bone density called subchondral sclerosis, and small cysts called subchondral cysts. But remember, X-rays do not show cartilage directly. They only show the space between bones, which gets smaller as cartilage wears away. Your pain might be worse than your X-ray because X-rays mainly reveal bone changes, not soft tissues or early cartilage damage. Soft tissues like cartilage, tendons, ligaments, and the joint lining are soft and do not show up well on X-ray images. If these tissues are inflamed or damaged, they can cause significant pain even if the bones look normal or only slightly affected on the X-ray. Pain in osteoarthritis is complex. It can come from inflammation inside the joint, muscle weakness, nerve irritation, or even psychological factors like stress. These sources of pain are not visible on X-ray images. Early in the disease, cartilage damage might be happening, but it does not cause visible bone changes yet. So, you could have pain from early cartilage breakdown or mild inflammation, but your X-ray might look almost normal. Interestingly, many people have X-ray signs of osteoarthritis but do not feel any pain. This shows that the presence of X-ray changes does not always match how much pain you experience. Conversely, some people with severe pain have only mild or no visible changes on their X-ray. Standard X-ray views might also miss damage in parts of the joint that are not directly in the imaging plane. For example, in the knee, some compartments might be affected but not visible on a standard X-ray. Doctors often use your symptoms, physical exams, and sometimes additional tests like magnetic resonance imaging to get a clearer picture. Magnetic resonance imaging can show soft tissues and cartilage more clearly than X-rays. If your pain is persistent or severe and your X-ray looks normal, your doctor might suggest further testing to find other causes or to detect early cartilage damage. Remember, osteoarthritis pain can fluctuate. You might feel worse after activity, during weather changes, or due to other factors, even if your X-ray stays the same. That's because pain is influenced by many things beyond what the X-ray shows. In summary, your pain can be worse than your X-ray because X-rays only show bone changes, not early cartilage damage or soft tissue problems. Pain is affected by many factors that are not visible on imaging. Some people have clear X-ray signs but no pain, and others have pain with little visible damage. That's why your doctor considers your symptoms alongside imaging results to understand and treat your osteoarthritis better. If your pain feels out of proportion to what the X-ray shows, it's still real and important. It just reflects how complex osteoarthritis really is and the limits of what X-ray imaging can tell us.